Please have a seat. Give me 1 second here. How are you doing today? Everything alright? Oh, we did get your appointment notice for today, but before that, I would like to introduce myself. I'm DrSleep, and I'll be taking care of you today. Could you tell me your name just for verification? Perfect, okay. Alright, why don't you have a seat and square up to me? Yeah, so I can see your eyes on my level. Perfect, make yourself comfortable and I will just get started. Let me just take a few notes about this. Alright, so all good. How are you feeling? Talk to me. We did get your call about you wanting a cranial nerve examination today. Yes. Okay, perfect. So, before we get into that, let me ask you a few questions. Could you tell me, have you been having a lot of headaches recently? Just on and off. Okay. How about when you go outside and take a walk in the sun, or you come across a really bright light, do you feel like you start to get a headache? Okay, alright. Have you been feeling any kind of sickness recently, other than the headaches? Oh, really? Why is this mild? It's not too bad, is it? Have you had to come to the hospital or get it checked before? Oh, okay, perfect, okay. Let me note it down. Okay. Yeah, these sort of questions are kind of important for us before we jump into the exam, so we don't misdiagnose you, you know. It's very normal, don't worry. Are you comfortable in your seat? Is everything alright? Do you want me to turn down the AC? It tends to get quite hot sometimes, so I have to keep it on. And I'm always walking here and there, so... Also, I want to apologize for being a bit late. I got stuck up, or caught up with the other patient, and it just took a lot of my time, but I'm here. I'm gonna give you my full attention now. Thank you. Alright, so one last question. Have you ever done a cranial nerve examination before? Have you ever got it done by someone else? Oh, this is your first time. You've never got a cranial nerve examination. Okay, that's concerning. But not to worry. You are in safe hands, and I'll make sure I do my best for you. Okay, perfect. So, just to introduce you to the examination, let me keep this down. I've had my notes for now. The examination goes in 3 parts, maybe even 4 if I feel necessary. The first part would be an eye exam, and then we'll check your taste, your sense of taste, and then after that we'll move to checking your sense of hearing. Yes, these are the main 3 examinations. We break down the cranial nerve examination too, and it's quite important that we know if the patient is doing well in all of them before we come to a diagnosis or try and find the problem. Yes, it could be anything, but it's a must that we get these done very, very properly. Get like an official report of these things, you know. So, I'm just wearing my gloves while I talk to you. So the first exam is gonna be the eye exam, and all you have to do is just follow my instructions, do what I'm saying exactly like I'm saying, and just follow my instructions to the dot, and you'll be fine. These gloves sometimes take a lot of time to put on, and I usually struggle with them, but all of my other patients know that, and now you do too. But do you have any questions before we get started? Well, like I said, you just have to follow my instructions, and I'll break down the eye test into several parts, and I'll explain to you before I conduct them. And you just have to follow the instructions. They're very basic. It'll be in simple English, according to Dan's. Okay. Okay. Now I want you to keep on doing this. Slowly. And keep your eyes on my fingertips, like I said. Good job. Good job. Right, I'm gonna fasten the pace a bit. Okay. Perfect. Okay, perfect. Good job. Good job. Alright. Good. Perfect. Now I want you to tell me when each of my hands go out of your peripheral vision and you stop seeing them. Okay, so I'm gonna do it very slowly. Alright, you ready? Okay. Now. Okay, good. On the other hand. Now. Perfect. Once again. Okay. The other eye. Now. Alright. Let's do it one more time. Okay. Good. Good. Okay, good. I see. That's really good. Let me note it down. Looks good to me. Okay. Okay, so we'll move on to the second part now. I just want you to tell me how many fingers am I holding up right now. Okay. How about right now? Okay. How about now? Okay. How about now? Okay. How about now? Good job. How about now? How many fingers am I holding up? How many fingers am I holding up? How many fingers am I holding up? Good job. How many fingers am I holding up? Alright. How many fingers am I holding up now? How about now? Good job. How about now? Good job. Perfect. That was great. That was great. Okay, so now I'm just gonna look into your eyes a bit. The light on this tool, on my friendly little tool, will light up, and it might be a little bright, but it's important for me to check into your eyes and see if anything's wrong or not. Okay, so I'm gonna come close to you, and if I may, I want you to close one eye for me, please, and keep the other one open. Okay, perfect. Now just gonna look directly into it. Yes. Okay. Can you move from left to right? Okay, perfect. Okay, let's do the other eye. Close your eyes. And then again. Could you move it from left to right slowly? And now back from right to left. Okay, good. Let's do it one more time. Please close your eye. And then let me see. Can you move it from left to right? Good job. And slowly move it back from right to left. Okay, perfect. Once again, the other eye. Could you move it from left to right? And then move your eyes back right to left. Okay. Good job. So, now I want you to look at the light and follow it wherever it goes, slowly. Again, just like the first exercise, I just want you to look at the light with your eyes and not move your head. Do you get it? Okay, perfect. Alright, let's start. We'll start from the center. I just want you to follow the light. Good job. And now slowly to the other direction. Good job. Once again, back to the center. Now we'll do this again, alright? Good. Back to the center. Now the other direction. You're doing great. And back to the center. Okay, again, we're just gonna keep our eyes on the light as I move this light closer to you and further away from you, okay? Alright, let's do that. Good job. And then to the other direction. Good. Once again. Other direction. And then slowly upwards and back. And now, try and keep your eyes on the light. Slowly move your eyes around. That's good. That's good. Now change the hands and once again I'm gonna move the light a bit back. Keep looking. And bring it a bit closer. Good job, really good job. Move it a bit back. Then bring it a bit closer. Really good job. Move it a bit back. Then bring it a little closer. Really good job. You're doing great. As soon as you stop seeing it in either direction, okay? Yes, follow the light and let me know when you stop seeing the light in either direction. Okay, perfect. Let's start. Now, okay. So back to the center. Okay, good job. Alright. Okay. Okay. Keep doing it. You're doing great. to this side once again. Okay, good job. Then one more time. Perfect. Okay, that's great. So awesome. Trust me, you're doing great. Alright, now I'm gonna ask you to close your left eye with your hand. Yes, and do you see these letters behind you? Yes, so I'm gonna point to a letter and I want you to try and read it with your eye closed. One of your eye closed, yes. Does that sound okay? Alright. So go ahead and close your left eye. And can you please tell me what letter is this? Okay. How about this? Alright. How about this letter? Okay. And now how about the letter at the top? Good job. How about letter this? Okay. Could you tell me what you see here? Okay. Could you tell me which letter is this? Okay. And how about this one? Okay. Now I'm gonna give you a few verbal instructions. Could you tell me the first letter in the third row? Okay. How about the second letter in the fifth row? Good job. How about the first letter in the second row? Okay. Now let's try that again. Could you tell me the third letter in the seventh row? Good job. Could you tell me the fourth letter in the third row? Trick question. Could you tell me the first letter you see, the biggest one? And are you able to decipher any of the smallest letters on the last row? Okay, could you tell me what you see? That's good. That's alright. Yeah, that could be a bit confusing, but you did good. Alright. So, with that, we kind of have finished your eye exam. Congratulations, how are you feeling? Like I said, it tends to get a bit detailed, and since this is your first exam, I have to make sure to walk you through everything properly. I hope the instructions were plain and simple and easy to understand for you. Yes, okay. Okay, perfect, good job. So, like I said, there are two more kinds of tests we have, but they're going to be relatively easier. So the next one, let's do a quick smell test and maybe a taste test as well, along with, okay? Why don't you make yourself comfortable again, meanwhile I'll grab my equipment. Okay. So in this exam, actually this exam is very easy. All I'm going to do is ask you to smell a few of my essences, and I want you to identify what you smell to the best of your knowledge. Okay, so you're just going to be seated there, and I'm going to bring a bottle next to your nose, and I'm going to ask you to gently take a whiff and tell me what you smell. Sounds easy, right? Should be fun. Okay, let's start with the first one then. Okay, I'm gonna bring this next to your left nostril. Take a breath in. And I'll bring it back. Hold your answer. Now I'm gonna bring it next to your other nostril. Smell it again. And exhale. smell? This is actually one of my favorite smells in the world. It's lemon, and you're right. Good job. So, we have a couple more. Let's see if you get this one right. Again, this time I would like you to close one of your nostrils. Okay, so go ahead and close your other nostril and tell me what you smell. Inhale slowly. Okay, now why don't you close your other nostril and inhale from the next one. Okay, what do you smell? Oh, you can't tell. Would you like to sniff it one more time? Okay, I'm gonna give you one last sniff. Okay. Okay, you think it's rose, but it's actually eucalyptus. So, I guess this is a bit tricky. A lot of my patients don't get this one in one shot. But eventually, when you get used to it, you'll identify it a bit more easily. But no worries. It's quite common. And then we have one more, and let's see if you get this one. Now I want you to keep both your nostrils open for this one, and then take a whiff. Good job. Hold it, and then take a little whiff again. What do you smell? I'll let you think. Good job. That was Jasmine. Good job. You did good. Alright. That was pretty quick. Like I said, these were the most fun ones. And I have another fun one coming up for you. Now these are edible oils. Let me get them. And I want you to stick your tongue out. I'm gonna drop a small quantity on your tongue, on the tip of your tongue, and I want you to let me know what you can taste, okay? Stick your tongue out for me, please. Just on the tip. I'll just... That's definitely rose. Good job. I see you really like the rose flavor. How about the next one I have over here? This is again a personal favorite of mine. But please stick your tongue out once again. Okay. Good job. Another flower. That was jasmine. You're right. And for the final one, now this might be a bit of a shocking one. I hope you enjoy the taste. It's kind of strong. You're right, that's mint or peppermint. Good job, once again. Okay. Looks like you're good. I hope you enjoyed those two tests at least. Okay. Now, saying that, all that is left to do is get your ears tested, and I'm just gonna do that very quickly. I'll give you a moment to relax. I'll be back with my tools once again. Okay, I'm back. Now I've got my tool once again, and now we can get started with our ear exam. So the first part is I'm just gonna use my tool and look into your ears, make sure they're clean, make sure everything looks normal. I'm gonna do that to both of the ears, to each ear I mean. Okay, So anytime if you feel any kind of tingly sensation or if you're uncomfortable, please let me know. I will pause immediately. Sounds good. Okay, so why don't you just sit back up straight, face me, square up, and then I'm gonna look into your first ear right now. Let's do it. I'm gonna get a bit close to you. Okay, I see. Oh, very clean. This here certainly is very clean. Don't see a lot. It's good. Let me move around a bit. Okay. Now let's do the other ear. Right, cleanish here as well. Could get a bit more. Okay, looks good. Let me quickly check if you can hear these sounds. Let me know if you find them uncomfortable or if it bothers you in any way. But I just want to see your reaction to it, okay? Okay. Okay, now I'm gonna cup your ears and slowly massage them. Okay. Check for some abnormal shape. Okay, seems good. Looks like I have to check one more time, so I'm gonna go to this ear first again, okay? Alright, and now quickly the other ear as well. Let's do it. Perfect, good job. So, let me note everything down from the examination. How are you feeling? Everything okay? All good, all calm. Do you face any problems till now? You're doing good. Alright. Now, I did want to check your heartbeat. Before you go. So, I'm gonna make this a bit warm for you. And I would like you to, yes, just take a deep breath in for me, please. Hold it. And exhale. One more time. Take a deep breath in for me, please. Hold it. And exhale. Good. I'm just gonna check your heartbeat. Okay. Now one more time, I'm gonna ask you to take a deep breath in. And exhale. Good job. Now, take a deep breath in. And exhale. Good job. That was necessary, and you're almost done. You're doing great. Now for the final test, I'm just gonna quickly check your facial structure and make sure there's no abnormalities. Yes. I hope my gloves are not cold to your skin. Not quickly, just feeling your face and making sure everything feels normal. Might apply a bit of a pressure, so let me know if it gets too uncomfortable. And just making sure the shape is symmetrical and as it should be. And pressing my fingers against your cheeks, against your forehead, against your nose, against your lips, against your cheeks, against your forehead, against your nose, against your lips. Everything seems to be in order. Okay. So, let me note it down. I have the final results with me, and I'm gonna ask the nurse to mail it to you. And you can get a copy of it as well at the reception. But to me, everything looks to be okay. I feel your headaches might be a bit of a concern, and they might come back. You did good during most of the exam, but a couple of places here and there, we kind of missed the mark. So I'm going to prescribe to you a few medication which you can collect from the chemist, and the prescription would be available with the receptionist. But for the most part, I think you're okay. The headaches, if they do come back within the next month, for more, and if you feel it, if you experience it more than 3 times during the next month, I want you to make an appointment with us once again. But I don't think it's that serious of a problem. Certainly, if you get it a few times, make sure you use the medication as prescribed. Okay. With that said, you'll find the payment details and the prescription with the receptionist. And I thank you for coming in. I hope it was a pleasant experience. I know it was your first one. It can be a bit overwhelming, but I hope I did everything to make you feel calm and comfortable during the whole Cranial exam. Okay, thank you. As a token of appreciation as well, I would appreciate it if you could like the video and subscribe to the channel so that we can see you again in the next appointment. Does that sound good? I really appreciate that. Thank you. Okay, take care of yourself, your health, and your mental stress and your anxiety. And I will see you again in the next appointment. Bye-bye.